All right, so today what I'm going to do is I'm going to show you what I think is the best technique or mobility technique for the hip flexors, to strip out the hip flexors, loosen them up, open them up. And so let me show you a couple things first. We'll talk about my buddy here. This is Methuselah. And so a couple of things. There's two muscles that are very, very strong primary hip flexors. One is called the iliacus and the other is called the psoas major. The iliacus sits in this little fossa, this little basin-like depression of the pelvic bone here. And then it shares a common tendon that goes into this bump on the leg right here. So it runs over the pelvic brim right there and goes into that little bump called the lesser trochanter. Now, the psoas muscle goes from there and it attaches to the 12th vertebrae and all 5 lumbars. So 5, 4, 3, 2, 1, and the 12th vertebrae attaches to all of those. And the primary job of these muscles is to flex the thigh, or we usually call it hip flexion, but technically it's flexion of the thigh, okay, the upper leg. And so that muscle, or those muscles I should say, which they are separate muscles even though they share a common tendon, they get very, very tight. They get tight when we do core work, abdominal work, because we do a lot of hip flexion with a lot of different types of core work. And even if we're doing other things like kettlebell work, powerlifting, Olympic lifting, CrossFit, other types of functional fitness, you're using a lot of hip flexors. Okay, so what happens is these muscles get very tight, they get very knotted up, and we need to strip them out. So, appropriately so, I'm using my iron kettlebell from, or my skull kettlebell from Iron Company. And so I figured we keep the consistent theme. What we're going to do is, now you can use any kettlebell that has a nice handle like that, and so you're going to use the handle, okay, to work on these muscles. You're going to be extremely cautious. You're also going to check with your physician before trying any of this to make sure it's okay. All right, once you've done that, you're going to be careful to not be in the center of the abdomen anywhere where all the abdominal organs are. We're going to be on the outskirts. So if you look at this pelvic bone right here, we're literally going to be on the very inside of it here, and maybe we'll push over a little bit to get that psoas muscle. So what you're going to do is you're going to take what they're called horns of the kettlebell. You're going to take the horn of the kettlebell and you are going to lay on it. Now, you're going to angle it. Okay, so I'm angling it this way. All right, so basically, I'm getting it's actually the other way, sorry. I'm getting the bell into that muscle area, okay? And then I can wind it up. I can turn one way, I can turn the other way. You see I've got my leg on the same side straightened out. I can drop my weight on it, okay? And again, it's more about finding the points that are very tender and being gentle, and then gently breathing through them. 3 to 5 nice slow breaths, and then maybe move a little bit. Maybe floss back and forth to kind of have that handle of the bell rub into the muscle. Now, if you want to see what we're talking about, this is the angle, right? So we can see it on the video here. This is the angle we're using. I'll show you on this fella. We're going to angle it this way, okay? So we're using this angle of the kettlebell, all right? And then what we can do is it actually digs out the muscle that sits in that iliac fossa called the iliacus. And we can also, you know, put a little side pressure. So I've got that angle, same angle I just showed you, okay? So I go here. If I wind up and I wind towards the bell, okay, it gets nice into that fossa. If I wind the other direction, I start to get that psoas muscle more. So if I wind away from the bell, okay, I start to get the psoas muscle. Again, this is something you need to be careful doing, but it can be very effective at opening up those muscles. In my experience, and when I was in practice, about 80% of all the back pain that I encountered was from tight hamstrings, glutes, or psoas muscle. And the iliacus kind of goes along with that tight psoas as well. And so if we can open up these muscle groups, we can alleviate low back pain, we can also prevent injury, and of course, we can open up our mobility make ourselves less likely to be injured, as well as being more effective in the movements that we want to do. If you have any questions, let me know. Stay strong. I will see you next time.